Hey there. If you're a clinician, you know that trying to figure out insurance network requirements can feel, well, like a whole other job. So our goal here is simple. We're going to cut through all the noise of the provider manual and give you a really practical guide for working with the Aetna Behavioral Health Network. Let's get right into it. Before we jump into all the nuts and bolts, let's just take a second to remember the why behind all of this. Every single rule and process we're about to talk about, it's all in service of one thing: giving your patients the best, most consistent care possible. And that's exactly what this walkthrough is for, to save you time and headaches. We're going to break down just the essentials, the stuff you actually need to know for joining the network, managing patient care, and of course making all those admin tasks a little bit easier. All right, so let's start at square one, becoming an active provider in the Aetna network. It all begins with the credentialing process.
Aetna has this pretty streamlined into 4 basic steps. First, you'll go online to aetna.com to request to join. Now, the really key part is step 2, using the CAQH database. If you've used it before, you know it's a huge time saver. It's a universal system, so you don't have to resubmit all your info for every single insurer. Once that's done, you can call the number on your screen to check on your status. And just a heads up, you'll have to get re-credentialed every 3 years to keep everything fresh. Now, this next part is absolutely critical. You have got to keep your information up to date. Federal regulations actually require it for provider directories. So if anything on this list changes, and I mean anything, your location, your license, even your tax ID, you need to let Aetna know in writing within 14 days. This is so important for making sure patients can find you and, maybe just as importantly, that your claims get paid correctly.
Okay, so you're in the network. Great. Now the focus shifts to what you do every day: authorizing and managing patient care. Let's look at that workflow. So Aetna has some specific standards for how quickly patients need to be seen. Think of these as key quality benchmarks. For a non-life-threatening emergency, the expectation is within 6 hours. For routine initial visits, it's within 10 business days. And I really want to call out this last one, the follow-up after a hospital discharge. That needs to happen within 7 days. That is just crucial for preventing readmissions. The whole authorization process really hinges on this one concept: medically necessary services. You hear that term all the time, right? Well, this is the standard your documentation has to meet. It basically means that the care you're providing lines up with accepted clinical standards, it's right for the diagnosis, and it's not just, for convenience. This definition right here is what drives every single coverage decision.
So, what kind of services need that green light, that pre-certification, before you can even start? Well, as a general rule, it's going to be all inpatient care and those intermediate levels, like a partial hospitalization program. Applied Behavior Analysis, or ABA, is on that list too. But here is the most important thing to remember. You have to always check the requirements for each patient's specific plan. Benefits can really vary, so you've got to verify it every time.
Great care is about more than just what happens in a session. It's really about a partnership in quality. So this next part is all about that shared commitment to keeping standards high through good collaboration.
And this partnership is definitely a two-way street. On your end, you've got responsibilities like getting permission to coordinate care and keeping really good records. In return, Aetna commits to supporting you with things like clinical guidelines and case management programs. It's all about working together, with the patient right there at the center of it all. Speaking of records, I know it's everyone's favorite topic, but proper documentation is just non-negotiable. So here's a quick checklist of what they need to see. Your notes have to be readable, with the patient's name on every single page. Every entry needs a date, your signature, and your title. And of course, a thorough risk assessment and a clear treatment plan with goals are absolutely essential. Oh, and don't forget, you have to hang on to these records for at least 6 years.
All right, we've covered a lot: getting credentialed, authorizing care, and quality standards. For this last section, we're going to talk about the digital tools that are designed to make the admin side of your practice, well, a whole lot smoother.
This is the million-dollar question, isn't it? That administrative load can just be enormous, and it pulls you away from doing what you do best: caring for your patients. The answer, more and more, is all about using the right digital tools. And here it is. This is your command center for pretty much all of that: the provider portal on Availity.com. Seriously, think of this as your one-stop shop. You can check eligibility, submit claims, request pre-certification, get your EOBs, update your profile. It's all right there. It is designed to make your life easier. So if you do just one thing after this, here it is:
go to Availity.com and get yourself registered. Honestly, just getting comfortable with this one tool is going to be a total game changer for your practice's efficiency.
And that kind of brings us right back to where we started. With all these processes and tools, hopefully a little less mysterious, the real question is, how can you use this stuff to free up more of your time, more of your mental energy, so you can focus on what actually matters, the health and progress of your patients?